throughout my life and career, as I reflected back with a reporter the other day, when I was in high school, and I hadn't thought of it this way until recently, when I was in high school and I was a senior, my classmates asked me to run for class president. Wasn't even on my radar screen. But they saw something that I wasn't even thinking about. I ran and won. When I was in college, I was a member of the Morehouse College Glee Club. And in the senior year, the Glee Club elects the president of the Glee Club. We were a touring Glee Club. We traveled around the country. I was also in the Morehouse College Quartet. So, Julie, I was a quartet member, so I wasn't too bad. I still do it to me every once in a while,
Careful, there's lots of instruments here.
But I know. No, I got a luncheon I got to go to, so I won't be able to do. We won't be able to do. And the way the Glee Club elects the president for that year is by secret ballot. There's not a slate of nominees. Everybody gets a blank piece of paper. Write down who you want to be president of the Glee Club. They selected me, to my surprise. You don't campaign for it. You don't ask for it. You don't do balloons or bumper stickers. So they saw something in me relative to the potential to be their leader. And that has happened to me many times in my life and my career. So it starts with, what do you really want to do? What do you really have a passion for? And then you have to make those assessments. Yes, sir.
How would you fix Social Security?
How would I fix Social Security? Thought you'd never ask. I'd use the Chilean model. It's called a personal retirement accounts approach. George Bush tried it, didn't quite get it across the finish line because he got demagogued, and he didn't get help from the other Republicans in Congress to help sell the idea. They let him go out on that limb and let it get cut off. Great idea. Here's what Chile did 30 years ago. First of all, their payroll tax for every worker, for every dollar that they earned, was 27%. 27. We at 15.3. And it keeps creeping up and up and up and up. So here's what you do. You give younger workers the option. And Representative Paul Ryan has already laid this out. Here again, this is not a new idea. Younger workers, 40 years and younger, would be given the option to take half of their payroll tax, 6.2%, and put it in a self-directed account. The other half, they have to contribute to Social Security to help pay the benefits for those that have no other option at this point except to try to get their Social Security benefits. By giving up 50% of your FICA contribution and then investing in a self-directed account with your name on it, you will have more for retirement by the time you turn 65 or 70 that you will have if you continue to put it in the current system. So it's using a personal retirement account approach, just like they did in Chile. And in Chile, after 3 years, 90% of the workers elected, even if they were above the age limit, 90% of them elected to go on the personal retirement account approach. That's how we fix Social Security such that it eventually goes away. Yes?
I have a question about the entitlement that you started to talk about.
Yes.
I'm not very politically savvy. I'm a healthcare worker, which I think the healthcare community tends to often feel more democratic because we want for our patients to have what they need. And I'm not able to align myself with the Democratic Party for other reasons, but I think this is a constant tension in the healthcare community. I mean, I think it's even something to speak to as you go on to realize that people want the best for their patients, and you get to the point where that's all you think about. That's what we're supposed to think about. So thinking about, what's fair, what's just, all you want is that person to be well and have what they need to be well. But I think about the entitlement. How do you deal with, I've seen this the most in welfare communities, this feeling that you want for your patients. Honestly, they often got more than patients that were even on Medicaid. Like Medicaid, we loved when we had Medicaid patients because they will get everything.
Yes.
Yeah. Unless the office when they had changes between parties in office, we saw a big change, and that has had a forever effect on me that I haven't been able to completely lay down.
Right.
But, so how do you propose helping to empower generational dependence on the system? I mean, how does one help?
Couple of ideas as part of a bigger package. First, under the current tax code, you make deductibility of health insurance premiums the same regardless of who pays for it. Right now, the employer gets it as a business deduction. But if I go out and buy health insurance as an individual that just want to buy it, I can't deduct it. That's not right. So this encourages employers to continue to try and provide health insurance for their employees. Steve Forbes did an experiment back in the early 1990s where he set up health insurance accounts for all of his employees. He put the money in there and he said, you buy the insurance that you want, and if you buy a $1,200 package, the extra $300 stays in your account and it's your money. And so over time they were able to build up an emergency fund, because when it's their money, they're going to spend it more responsibly. So the first thing is you change the tax treatment of, when you change the tax treatment of health insurance or medical costs, guess what? Then you can make the shift of empowering people to see it as their money rather than their employer's money or the government's money. This is the problem with a lot of these state programs. We pay these super Cadillac, Mercedes, Lexus benefit packages. Here's a second thing that we can do to begin to move towards self-empowerment and people being in control. Instead of restricting medical savings accounts, open up medical savings accounts. The Obamacare restricts it more. So the point is, and then thirdly, change the rules in Medicare such that the states have more power. We streamline the paperwork. Many doctors are spending 20 to 25% of their practice just doing the paperwork. That is ridiculous. We can't streamline that. So if you start to make the shift from it's your money, and employers are ready to give them, assign that amount of money so they can make the decisions, then we start to change that whole attitude and that whole culture about who is responsible for their health care. Just like in the private sector, years ago, a lot of companies went from defined benefits to defined contributions. The difference being, people were working for corporations and they had a booklet of what their benefits were going to be in terms of retirement benefits and medical benefits once they retired. So when you retire, you expected those benefits as spelled out. Many companies converted over to defined contributions. The company would put in so much money, it's your money. You could put in money, it's your money. And then you decide what type of retirement plan you wanted. Did you want an annuity? Did you want a lump sum payment? Put it more in the hands of the employee. It's very similar to that type of approach. Yes, sir.
Mr. Cain, you haven't touched on education, and I'm surprised that we haven't had some questions about it here, but I'd like to touch on something in our little town of Hollis here. We have a high school that is a blue ribbon school in the United States of America, which means that it is one of the top 40 public schools in the country.
Congratulations.
Yes, sir, but I'd like to tell you something about that, though. We have 51% of our juniors that are proficient in math. 51% are proficient in math. 43% are proficient in science. That's in this town. And this town is touted as a wonderful school. But the problem that we have is that 51% is in the 40 best schools in the United States of America. We have a problem all over, and we keep talking about throwing money at and how wonderful our education system is, but we're not going in the right direction.
I believe in unbundling education from the federal level down. What that means is get government's sticky little hands out of trying to tell states how to do education in their states.
Exactly.
And when I say unbundle, secondly, if you start out by granting block grants with one page of guidelines. Block grants means that instead of having all of these programs with all of these stipulations, if New Hampshire got, I'm just picking a number, if New Hampshire got $5 billion 2 years ago over the last 2 years, then you get $5 billion out of the money that they are, because we haven't changed the system yet, $5 billion, and then you decide how you want to apply that to education. without these government strings attached. The following year, you might only get $4.5 billion, but you're in control. And then you can decide how you best want to do that. The other thing is, states are in a much better position to break in some instances, the chains of the unions wanting more money, but not holding them accountable. So if the states are responsible for it, you can develop programs to pay teachers based upon merit and performance. What a novel idea. We do it in the private sector all the time.
Yeah.
So my approach is unbundle it such that the government gets out of the business of trying to tell the states how to educate kids and micromanage education. And over time, the states and the local communities will have more control over, what they do with education. As you can see, that is the theme. That is the theme that. Okay, my staff he's about to lose his arm back there, saying, "Let's go." All right. Okay. He's just doing his job. So I call it unbundling. All right, I call it unbundling. So my whole approach to most of these is empower the states, empower businesses, and empower people. Don't empower government, because all it does is get bigger. All right. Thank y'all. I've gotten a high sign. Let me just close with this. One of my favorite presidents, I don't know if he was one of your favorites, but his name was Ronald Reagan. And he said, freedom is never more than one generation away from extinction. It must be fought for. It must be protected. Or one day we are going to have to tell our children and our grandchildren what the United States used to be like when men were free. I'm not going to have that conversation with my children, with my grandchildren. And I don't think you want to have that conversation with your grandchildren. Thank you all again for being here.